Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. And our guests today are Dr. Colin Banas. He's Chief Medical Officer at DrFirst, and Dr. Grace Cordovano. She's co-founder of Unblock Health. Welcome.
Thanks so much, John, for having us.
Yeah, thank you for having me.
Yeah, excited for today's discussion. It's great to have some really unique perspectives in this executive series that we're doing with DrFirst. But before we dive in there, Grace, maybe you could start us off. Tell us a little bit about yourself and Unblock Health.
Sure. So I'm Grace Cordovano. I'm a board-certified patient advocate specializing in the oncology space. And my day-to-day is working with patients and their loved ones from point of diagnosis through survivorship or end-of-life care planning. My sole purpose is to reduce suffering and connect patients to the information, tools, and technology they need to make an informed decision about their care. I'm also the co-founder of Unblock Health, which is a software that was designed specifically for patient advocates, patient navigators, and patients, connecting them directly to health information management to relieve the administrative burden of requesting your medical records, getting access to images, pathology, and also requesting corrections to any errors that may be found in your records. And it's a whole movement to unblock health by educating the ecosystem about patients and care partners' needs with medical records and educating patients about policies and upcoming things in the interoperability space. So excited to be here.
Yeah, that's wonderful.
Well, Grace is one of the best patient advocates in the world, one of the patient voices. So I appreciate you being here. Colin, how about yourself and DrFirst?
Yeah, Colin Banas, the Chief Medical Officer for DrFirst, internal medicine physician by training, joined the company about 5 years ago. And for those of you who don't know DrFirst, and hopefully you do, started as an e-prescribing company over almost 25 years ago. So before we were doing e-prescribing, DrFirst was pioneering in that space. And from there, we've really evolved and blossomed into what I would consider the sweet spot for the company, which is intelligent medication management. So how can I reduce the friction in prescribing? How can I help providers and patients understand more about their medications so that we can get them on therapy and keep them on therapy? So there's a lot of solutions we have, including medication safety, medication reconciliation, price transparency. So showing the patient what the copay is going to be so that we can have an intelligent conversation about the prescription before they have the sticker shock when they get to the pharmacy, things like that. And so over the course of 2 decades, it's really evolved into basically a fascinating place to work.
Yeah, absolutely. DrFirst is powering so much of healthcare, and many people don't even realize it. So I appreciate all the work you do to help with that transparency. But Grace, maybe we could start with kind of your patient perspective. Where are we at with patients being able to get access to their records and make it portable?
Mm-hmm. I think that's a great question because we've definitely seen an evolution, and I think because of all the tireless work of the Office of the National Coordinator, we're seeing more seamless access to results, such as test results and pathology results, imaging, and most patients do enjoy, and their families do enjoy having that access, but there are friction points in where some people need support, or if there's something catastrophic that may be there. Some patients may want additional resources that are really like tech-enabled human touch to help guide them if they can't get in touch with their provider. We're definitely still lacking on access to images, and that's a major problem when you have a chronic illness, multiple comorbidities, something life-altering like cancer. So we have quite a bit of work to do.
Yeah. Colin, what would you add? And she mentioned some of the regulations. Talk to us about some of the big health IT regulations that are impacting it as well.
I think this is a wonderful, peanut butter and chocolate moment right here, because Grace is talking about all of the excellent work that we as an industry have made towards getting patients access to their records, right? Still not perfect, but it's a lot better than it was 5 years ago. I sympathize, and my heart aches around the imaging as well. As a provider, I can't tell you how many times I've had to repeat imaging simply because I couldn't get the imaging fast enough. Yeah. And the read, the summary from the radiologist just isn't enough. You actually need the images. And so any work that we can do to break down those types of silos, I think is wonderful. I love the word friction. I think you're doing amazing work on reducing the friction from the patient perspective. Cancer care is so complicated as it is, getting aggregated records so that the entire care team can make the appropriate decisions and care plan is huge. What DrFirst wants to do is remove the friction on the prescribing side, on the management side, on the, so we're recently getting into the space of prior authorizations. I mentioned price transparency before. Well, prior authorizations are equally obnoxious. How can I get not just data, but information in front of providers at the point of care so that I can make this more about the patient and less about bureaucracy? So there's lots of regulations that have been coming down the pike. The ONC and CMS is basically, they're not just nudging anymore, they're sort of funneling us towards interoperability. And it's a welcome change because we didn't get there. We had 2 decades to figure this out and we still haven't figured it out. So
that's fair.
Yeah.
That's interesting. What's your perspective, Grace, on the regulations that are happening? There's a bit of a campaign for you to be chief patient officer of all the regulations because you actually read them and comment and provide feedback. What's your perspective? And maybe, are we moving fast enough or, what's your perspective there?
Great question. So I think between the information blocking rules, then you have the implementation of TEPCA going live, and then you had HTI-1, which public comment just closed on, and they announced how we're going to be handling AI responsibly. So much happening very quickly. I'm shocked HTI-2 hasn't dropped, or maybe
I think it just did actually this morning. Or there was something. I saw a headline. I missed what the details were.
So I've been busy. So okay. So that's exciting. So we'll have to dive into that, but. We are moving quite quickly, and there is a real big push. And I have to say that any feedback that is shared with ONC and HITAC, I do see change. They do listen.
Well, they read it.
They read it, and they respond. And every email, and I can't sing the praises of Dr. Mickey Tripathi. I've reached out so many times to say, I don't understand this. And in order to be an effective advocate and understand patients' rights and how to navigate things, we need support because I'm not an expert in these realms. So on the regulation front, yes, I think we're moving fast enough. I think things are evolving, especially when you look at the last 10 years where we were maybe on paper charts to now. My colleagues in medicine are like, well, we used to be on paper charts and we aren't here. I'm hungry for more because I work with people whose lives are on the line. So we need that information. And I'll comment not just radiology images, but DICOM pathology. Because getting the slides is a whole nother 3-ring circus, right? So and it's so frustrating because I know that there's images there. So I want to keep pushing because, again, there's people's lives on the line and we have work that we need to do to get the care that we need.
Yeah. What would you add, Colin?
It's on the one hand, it's fast. As a provider and as a patient, it's still not fast enough, right? It's probably never going to be fast enough for me, simply because if you compare the experience in healthcare to any of the other big verticals, retail, banking, aviation, whatever it is, those experiences are so seamlessly transformed by technology that I can change my airplane tickets and my seats like that, and you can't. That it's still not there in healthcare. It's still not there. Now I realize healthcare is a lot different, and it's like turning an aircraft carrier and crawl, walk, run. So I'm sort of speaking out of both sides of my mouth when I say not fast enough, and then hold on, this is really hard to do. You got to slow down, but it's probably never going to be enough for the providers and the patients out there. But we're getting there. I am optimistic. I think Mickey is fantastic. I hope another 4 years of Mickey. I'll tell you that right now.
Yeah, that'd be good. Well, and I would describe it more as an aircraft carrier stuck in the Suez Canal. Sometimes, right? And then it finally gets unstuck, makes some progress. It's a challenging situation. Colin, are there some other regulations that haven't been implemented yet that you think should or that you'd like to see happen?
Well, piggybacking on the HTI-1 and some of the TEFCA things, there's also the CMS prior auth rules that have recently been announced. So you're getting silos getting knocked down, payer-to-payer interaction, patient-to-payer interaction, and then prior authorization, at least on the medical benefit side. And so, again, I think we've seen this now for 2 decades, starting with meaningful use. Basically, when the industry doesn't do it on its own, the government kind of gets involved and says, all right, we got to force this along. And so I think that's what you're seeing in a lot of these regulations. And so I'm looking forward to it. I think individual access services is an exciting playground that's about to kick off because of TEFCA.
Interesting.
And because of the QHINs that were announced within the last year. So I'm sure you can talk, wax poetic about that. So.
Yeah, what do you think, Grace? Is there something you would, what's on your bucket list of regulations that you wish were done?
Sure. So I think I have to double down on the images, making mandatory exchange of DICOM images, especially at least starting somewhere. Cancer care, we have the cancer moonshot. Imaging is pivotal to establishing care. And I want to say probably something else that I'm passionate about is AI in clinical decision support. So the report, the score, whatever the output is of that clinical decision support, the only people that are privy to that are the providers or people inside the four walls of medicine. And I want to be able to access that and have it in my medical record. So I want access and exchange of those AI-powered derived outputs. I mean, I could keep going, but I'll stick to those two for now. And I have a suggestion for language that we need to put into regulation. Patients are not recognized as end users, co-creators, or creators of AI-powered tools and technologies, and we need to change that because it has implication on policy and how we look at data use and technology and rules and regulations. So I'm going to say patients are end users, and we have to start acknowledging that because they're sort of an afterthought.
Interesting. Well, how about on the vendor side? You know, we talked about legislation. What else could vendors do to kind of help patients and get access to this data that they need?
Well, you know what? Here's what I'll say. There's this amazing floor. Sponsor a patient. Forget the swag. Sponsor a patient to come and attend this event. Bring them onto there. There's so many rich and robust discussions on the floor. I would love to see patients part of that. We just aren't able to come here because of, you know, there's hotel, there's travel, and all the different costs that come. And I think it would be a great opportunity even to allow patients to walk the halls and bring that information back to their communities. And then start being curious about, what else can I implement in my care? How can I use my health information? Because there's such a wealth of information and interest on this floor alone. I think that would be really game-changing.
Yeah, that's awesome. Colin, how about yourself? What is DrFirst doing to really assist patients?
Yeah, you know, when I think about the best way to assist patients from the provider perspective, you know, wearing my provider hat and my CMO hat, burden reduction. How can I get rid of stupid stuff that's taking up cycles, you know, prior authorization cycles, or, you know, we have interoperability now, but it's not necessarily semantic interoperability all the time. So I can get your record from somewhere else, but then I have to re-input it into my record. You know, so there are ways that AI is going to power that. I think AI powering burden reduction, whether it's through things that can be automated, things that are relatively safe, you know, summarization, things like that. And then, you know, I think that's just the tip of the iceberg, because then we're going to get to the clinical decision support, AI-powered decision support. But anything that can free up cycles is going to allow me as a provider to give back to my patient. And so I think that's huge. And then I also think, I'll go back to individual access services. This ability for the patients to start to own the record, to make that record portable, to send it to whomever, is going to be a game changer, I think.
Wow. You know, I want to dive into AI in a second, but Grace, I don't think I've heard the patient perspective on all their providers being burnt out. Like, we hear about burnout providers, burnout nurses. What is your experience from the patient side when you know? I've had the doctor head down in the laptop, but that's not necessarily burnout. Like, what have you seen there?
Yeah, well, you know, I appreciate your question, because patients and families are burnt out too.
Oh, that's fair.
Patient administrative burden
real.
is a silent public health crisis. No one's really monitoring it, measuring it.
Yeah.
And the sicker someone is, and the more maybe social determinants of health, or maybe there's a aging parent, a sick parent, you have your own health condition, maybe you have children that have health conditions. It gets very complicated very quickly. So I encourage even looking from a vendor perspective, how can you solve both sides of the coin? Because the doctor and the patient are the same team. So, you know, a lot of the burden that you're facing, we also are seeing, and we're struggling and fighting, you know, prior authorizations. When there's a denial, we're also pushing.
It's the perfect example.
So I think the sweet spot for me would be which vendors are able to address provider and patient administrative burden. Knock that out, and now you start reducing friction, which will help collaboration and build that relationship.
It goes back to transparency, right? So as you were talking, the whole time I was thinking of prior auth, because I recently went through a prior auth nightmare for a patient of mine. It was a medication they've been on for years. Something happened where now I needed a prior auth again. Don't get me started on that, because same insurer, you can see that. And it required me to have a fax number, which I actually don't have a fax number. because why would I have a fax number? But of course, you still need a fax number of these. But anyway, the patient is pinging me every 24 to 48 hours because they don't understand where the process stands. I don't have the same visibility. I have to keep calling or looking on the website. And there's just this huge disconnect and and then eventually it gets denied, and I don't have a good rationale for it, and there's just not enough transparency.
Wow.
Right? Think about ordering a pizza. The pizza tracker tells me along the way, right? It was ordered, it was received, it's being baked, someone's got it, it's on the way. We could do that for prior. This is 2024. I mean, and that visibility would benefit both the patient and the provider, and it would bring the stress way down because I could see,
I want to add to that because a lot of the times these things are denied because they're not medically necessary, and the information, like the medical records, have just not gotten there,
and so
or they're sent to the wrong person. If you have something in oncology and you're sending it to the podiatrist, and then you're fighting against the AI-powered batch denial process also. So that's actually a lot of fun. So I think from a transparency standpoint, where I as a patient want to see, I also want to see why it was denied, more transparency, what's missing, what did it not meet, is this a standard care, who reviewed it, and give me your license number too. Because what my opinion is, I see patients die because they're waiting and they're getting denials. Well, my opinion is maybe we should start listing prior auth as a cause of death, because we can document and track it. I wonder if that would make a difference.
Interesting. Wow, it's pretty sad to say we track our pizzas better than our prior auth. Like that's a problem. You mentioned AI, and I think we get kicked out of healthcare if you don't mention AI right now. But tell us a little bit, Grace, maybe you could start, and then Colin. How about AI when it comes to patient access? What do you see happening there? Where are patients benefiting?
So many exciting use cases. We have a lot of work coming up. Stay tuned. I'll be posting on LinkedIn. We have a new hashtag, Dave DeBronkart, and a number of advocates are talking about patients use AI.
Okay,
and we're going to be talking about how patients are using it right now, from using an LLM to curate their record that they now have access to and putting it in, and how we're distilling notes, and how we're trying to prepare for appointments, and how we're fighting patient administrative burden, writing letters of medical necessity to fight back against any kind of insurance denials, filing for Social Security disability benefits. There's so many great uses, with caution, of course, but the administrative burden parts are things that it's well positioned to handle. And again, not recognizing that patients are end users, co-creators, and creating their own solutions. Like, shout out to Dana Lewis. I mean, she's a great example. There's so many of us that are doing these things. I think industry really would benefit from paying attention to see how we're doing it and working and co-creating together.
I love that. Colin?
I mentioned a lot of them before, administrative burden on the provider side. I have colleagues that are doing things like using LLM to help curate their inbox. Right? Help me generate the response to my patient, recognizing that it's only a starting point and that I need to make sure that it's accurate and fill in the gaps. But it's had great success at a lot of large academic health systems. It cuts down the amount of time to get back to the patient, cuts down on the administrative burden on the provider, and so these are simple things, and of course, AI is not just LLM. We've been doing algorithms, we've been doing evidence-based medicine and clinical decision support for quite some time. I think complex disease states such as oncology, such as sepsis, are going to really benefit in the next 3 to 5 years from the AI revolution. My favorite quote is, I think we overestimate the impact of AI in the first 2 years, but underestimate where we will be in 10 years.
Yeah.
I think we will be in a vastly different position in 2034. And I think providers and patients themselves will say, how were we ever practicing medicine without this? I really truly believe that.
That's awesome. Colin, Grace, this was a lot of fun. I learned a lot and saw some interesting patient perspectives, which I love seeing. So thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, guys.
Thanks, John.
Thanks, John.